Pain by Amelia Altendorf and Abby Lyle. The objectives of this presentation are to describe the perception of pain, identify clients that would need pain screening, and understand how to perform a pain screening procedure. What is pain? Pain is a subjective experience and can be difficult to describe because everyone has a different experience of pain and various levels of pain tolerance. The awareness of pain on the surface of the skin is a primitive protective measure alerting humans to potential danger. So though the sensation of pain may be unpleasant, it's actually a good thing to feel pain. Pain is hard to quantify, and the different types of pain can be difficult to describe. Common words used to describe different types of pain include sharp, dull, aching, throbbing, numb, scalding, piercing, shooting, and searing, just to name a few. Pedretti describes pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain can be sorted into two broad categories, acute and chronic pain. Acute pain is typically caused by tissue irritation or damage in relation to injury, disease, disability, or a medical procedure. It has a well-defined pain onset. Though acute pain is unpleasant, it serves a biologic purpose by directing attention to injury, irritation. Typically, acute pain is predictable and usually responds to medication. Chronic pain, on the other hand, is persistent pain and may begin as acute pain or may be more insidious and endure beyond the point at which a cause can be identified. Chronic pain does not appear to serve a biologic purpose and often produces significant changes in personality, lifestyle, and functional ability. Nociception is a term used in describing pain and is considered the detection of pain and is the body's message to do something or avoid doing something for pain relief. So when should pain be assessed? Pain should be assessed when a person knows they have damage to the somatosensory cortex. The somatosensory cortex provides our basic sensory information and can be divided into the primary and secondary somatosensory system. The primary somatosensory system includes light, touch, pain, temperature, pressure, vibration, and proprioception, and kinesthesia. This system is the orange portion of the brain that you see in the image. The primary somatosensory system is mediated by skin receptors, spinal nerves, spinal cord tracts, and the cortical somatosensory area 1. A person can have hyper or hyposensitivity to pain, and it can have symptoms including burning or aching pain sensation, inability to concentrate secondary to pain, sleep difficulty secondary to pain, recurrent self-injury secondary to decreased sensation, avoidance of specific self-care tasks secondary to infliction of pain. So if a patient presents with any of these symptoms, it's important to have them tested for pain perception. Pain evaluation. The particular pain screening that I will be performing tests pain hyposensitivity, or the inability to identify pain sensation when applied. Before performing the evaluation, it's important to review the patient's chart and indicate lesion or injury location if possible. Knowing what the patient's cognitive, hearing, and visual acuity status is important to be aware of before performing the screening. Explaining the goals and purpose of the screening is important in reducing anxiety or stress about the screening. Anxiety can also be minimized by performing a practice round with the patient's eyes open. So when performing this pain evaluation, do not use a safety pin if the patient presents skin breakdown, open wounds, or dry cracked skin. You can use a paper clip instead. Apply the stimulus to the patient's face, upper arm, forearm, digits, bottom of the feet, and toes in accordance with the dermatome charts. It is important to begin dorsally, then move to the ventral side of the body. It's also important to move proximal to distal. Impairment in pain sensation is indicated if the patient is unable to identify pain sensation when applied. A score of 2 out of 3 incorrect answers for 3 stimuli indicates impairment in the pain sensation. Okay, Abby, so today what we're going to be doing is testing your pain perception And we're going to start on the dorsal aspect of your body, so the bottom of your feet, and then we're going to move to your toes. And I'm going to use the sharp and dull end of a safety pin, and you'll close your eyes and just let me know whether you feel the sharp or dull end.
Okay.
And so we're going to start with your unaffected side, so your left side, and we're just going to start with the bottom of your feet. So if you will close your eyes for me, and then just let me know whether you feel the sharp or dull end.
Okay.
Okay.
Sharp.
Okay.
Dull.
Mm-hmm.
Sharp.
Okay. And now I'm going to move to your toes.
Sharp.
Okay.
Dull.
Mm-hmm.
Sharp.
Perfect. Thank you. So in this video, I only tested her unaffected side. So if I were to actually be performing this test, I would also compare it to her affected side. Okay, Abby, so now that we've just done your feet, we're going to do the same perception test on your upper body. So we're going to start with your face and do the sharp and dull, and then your arm, forearm, and fingers. And we're going to start with your unaffected side and move to your affected side. So if you'll just close your eyes for me, and we'll get started.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp.
Okay, you can open your eyes, and now we're going to move to your affected side.
Okay.
Okay, so if you'll close your eyes again.
Dull.
Yeah, sorry.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull.
All right, thank you so much. Okay, so in these videos, I applied the stimulus 3 times to each region of the body. This assessment can also be done functionally. If the patient, you can ask the patient if they can feel or identify sharp items or utensils when reaching into a kitchen drawer. You can also ask the patient to feel or identify a shoe placed on the wrong foot. In summary, pain is a subjective experience that manifests differently depending on the individual. This presentation shows how to test for pain and what to look for. Here are my references, and thank you for watching my presentation.